I am Dr. Erica Giwa. I have been practicing obstetrics and gynecology in the Houston area for a little over a decade now. I became connected with the March of Dimes working in that model and more deeply connected on a personal level when they actually reached out to our practice to have someone do a grand rounds on low-dose aspirin. During that presentation, I talked about my preterm delivery. I got pregnant for the first time. I was 35 years old. I can remember talking to my friend saying, I'm gonna deliver at 37 weeks. I already know my blood pressure is gonna be higher. And that's just what I anticipated. Throughout the first trimester, my blood pressure was fine. As I entered into the second trimester, approaching third trimester, maybe 24 weeks, my blood pressure started to get higher. I was actually seeing patients one day and I started to feel dizzy. So I asked my nurse to take my blood pressure and it was elevated. At this point, I was 30 weeks, so I knew I had to go to the hospital. I knew it was worsening. And I just remember crying. I was sitting there and I was just crying. I think I was scared. I think I kind of knew what was going to happen. So actually one of my nurses drove me to the hospital and I was admitted. They changed up the medications and I was spilling a lot of protein in my urine, several grams of protein in my urine, and my baby was measuring smaller than normal. I remember the morning that I knew I needed to deliver. They rounded on me and the doctor said, we're gonna try to wait until you're 34 weeks. And I was thinking, no, that can't happen. So we had that discussion and they came back later that morning and I said, I am really not trying to be a jerk, but I'm concerned about my baby's growth falling off of the curve. And I didn't want to have an emergent delivery. I didn't want to abrupt. I didn't want to have to run when we know what's going to happen. And I remember she looked at me and she's like, you're scared, aren't you? And I was, but I felt like the way that I was communicating to her was just facts. I asked her if she would call the maternal fetal medicine specialist, and that's who'd done my ultrasounds earlier. When I got to labor and delivery, my blood pressures were 200s over 110s, and my baby's heart tone started going down. So the physician that I talked to earlier came in, and she looked at me and she said, it was a good call, you needed to deliver. Really, when I noticed that things, or I thought that things should have gone differently, was in the postpartum period. After I delivered, my blood pressures were still extremely high. And the thing that was odd to me is that sometimes I would tell the nurse, hey, I'm not feeling well, can you check my blood pressure? And it was elevated. And so to me, as a provider, if you had someone who just delivered at 31 weeks, with elevated blood pressures, you should come and check and see how they're doing. But no one did. And this went on for many nights. So one day the nurse came in, this is the same routine, blood pressure's elevated. And I asked her, I said, can you call the on-call doctor? Tell the on-call doctor that I need to be treated with hydralazine. And so at that point she called the charge nurse, and the charge nurse came in. And, she's looking on the computer and typing, and she says, and I said, at what point are you guys going to treat me? And she said, oh, everybody doesn't get that medication. We have times when we give it and times when we don't. And I said, I know when the medication should be given because I'm an OB-GYN. And so then she left out, she comes back in, and they give me oral hydralazine, which is not what's indicated. You should give IV. And I remember the nurse pacing around the room, and as they're giving me the medication, and I told her, I said, I don't want to have a stroke. And she didn't even look at me in the face. She walked out of the room and they never came back. The blood pressure went up again, and I said, call my doctor and tell her I want her to come to my room. And so she came to my room and I said, I can't have my blood pressure this high. It can't stay this high. And I told her, if you need to call cardiology, call somebody, the blood pressure has to come down. And so at that point, they started another IV. They gave me IV blood pressure medication, and I went to the ICU. But this should have happened postpartum day 1. I was so scared. And you, as a physician, you're not used to being on that side. And I called one of my close friends, and I told her I was going to leave the hospital against medical advice. And I was going to go to the hospital where I practiced because I know that they were going to treat me. And she told me not to leave. I mean, I was like bawling, I was crying, and I was thinking, what if I have a stroke? What if I'm incapacitated? I was 35. This is my first child. I can't have a stroke. I remember understanding that something went wrong. But somehow it kind of felt like my fault. Like maybe I should have, how could this have happened? How could it go so many days? And I just kind of tucked it in. I was like, it's over. I'm healthy now. And I really did not think about this again until I started working on the work groups for maternal mortality. Until I started hearing the other stories, I was like, oh my God, this really happens. And people are telling the truth. And people, sometimes they aren't listening. And it's dangerous. The major point that I would like to express to the lawmakers is that it is really important to understand that prenatal care doesn't stop at the time of delivery. It is really important for women to have care beyond that point. When we look at maternal mortality, we know that cardiovascular disease is one of the leading causes of death. What would be amazing is if Medicaid lasted 12 months postpartum. Women need to be able to follow up for a full 12 months in order to make sure they have healed, they have received the appropriate treatment before they enter into another pregnancy. So that would be my major message to lawmakers.